Welcome to today's Survivor Circle session on the topic of understanding talk therapy. My name is Becky Perkins. I'm the Survivor Support Specialist here at Zero Abuse Project, and we're very glad that you've joined us today. I'm very happy to welcome Dr. Melanie Varney, who's a licensed clinician who will be leading our presentation today. Before she begins, just a couple of notes about participating today in the session. So on your screen, you should see the live stream in a box. If you would like to make that larger, there should be an icon in the bottom right-hand corner of the screen to make it a full screen if you would prefer that. And also on the page is a chat box if you would like to submit some questions or some comments at any point during the presentation. Feel free to type those in there, and we will certainly save time at the end of the session today to have some discussion back and forth through chat, some questions and answers, and any comments that you have. So without further ado, I will turn it over to Melanie.
Thank you. Hi, my name is Melanie, and I have a really broad topic today, which is probably a little bit, of a high expectation, but I'm going to try to talk today about the really basic 101s of talk therapy. I've noticed that even though there is a lot more openness, public discussions around going to therapy, encouraging others to go, there's still a lot of confusion around the process. How would I get started if I wanted to? What am I going to expect? How do I find a therapist? Can I afford it? And so this presentation has come out of questions that I get often from my clients or people who call my practice interested in therapy. It's also something I've experienced as a client. I've been going to therapy on and off since I was 16, and it's been different every time trying to find somebody. And it's just a really good resource for people. There's a lot more accessible options than there used to be. We still have a ways to go to continue to make it more and more accessible, but in a lot of ways it has become more. And so wanting people to understand what their options could be, should they be interested in trying it. This is our funding acknowledgement. And then these are the really kind of broad 101 questions that I'm going to hopefully go over today. And hopefully by the end, you'll feel a little bit more confident in understanding what your options might be. So I'm going to start with the different types of clinicians. Clinician just means somebody whose main service that they provide is therapy. So there may be people who are licensed therapists, but they predominantly do administrative work, or they predominantly do research, or they predominantly teach. So when we say clinician, we just mean a therapist whose predominant service that they're offering is to do actual therapy. So there's a few different types of degrees and trainings that provide talk therapy, which also is sometimes called psychotherapy, mental health counseling. These are all interchangeable. They all fall under talk therapy, meaning that the main intervention is dialogue-based, verbal-based. So these first four listed are probably the most common credentials that you'll see and look for. The training is going to differ slightly across each discipline, but in a lot of ways they're interchangeable in that the common thread between all of these first four listed degrees are that they are predominantly trained in offering talk therapy, psychotherapy. And so you can look for any one of those degrees would be appropriate. The acronyms differ across states, so that might get a little bit confusing. So you can always do a quick little Google, and you'll just want to make sure that they're licensed by the state, licensed by the health department. That lets you know that it's a professional health service worker that can provide these services to you. I included the bottom two as well, psychiatrists and psychiatric nurses. Usually their main function is to prescribe medication, but they do sometimes offer talk therapy as well. They're absolutely credentialed and able to. It's not as common their main or primary focus. Usually it's more medication prescription and management, but they do have that ability, so I've included them as well. So depending whether you're looking for talk therapy or medication, you may have more than one provider. Something that you may notice if you're looking at a therapist profile is they may reference the theory they use. So they may say, oh, I practice cognitive behavioral therapy, I practice humanistic therapy, I practice existential therapy. And that can get really confusing. People don't always know what that means or if they should be more educated on that. This website right here is kind of a nice little helpful cheat sheet. Here's a little screenshot of what it looks like if you go to Psychology Today and Google types of therapy. This is not all of the therapies listed, but just what I could fit in one screenshot. Once you click on one of them, it gives you, just a nice little cheat sheet blurb. And so I think this is nice so that people looking for therapy who are reading profiles can make sure they understand what they're even reading in the profile. Okay, this is their type of license or degree. This means that they can offer talk therapy, and this is maybe the theory that they use. A theory really just means that this is sort of their school of thought about what causes psychological distress or concerns and what they also believe contributes to relief or healing of those. And so different therapists fall under different schools of thought. You definitely do not need to know what all of those are or be well versed in them, but it's good to know that there is a different theoretical orientation for different therapists. You can be empowered to, do a quick little research on it and see, does that sound attractive to you? Does that resonate with you? And of course, it would be totally appropriate and normal to also ask a therapist that you're interested in meeting with, like, what do they mean by that? Can they explain it to you? That's a really common, totally appropriate question. I also have in here some research done by Wampold and some of his associates because they did a bunch of meta-analysis across like hundreds and hundreds of studies looking at the effectiveness of different counseling theories. And some of what they found was that really the most significant outcomes of effectiveness were sort of common factors outside of theoretical orientation. And so as a client, you don't need to worry too much about, like, do I absolutely need a therapist who has a doctorate and is a psychologist, or what about a social worker instead? And then again, from there, which theory is important to me? That can be really overwhelming and can sort of feel like analysis paralysis, like too much decision making on the front end, which can cause a little bit of fatigue because, again, it can be a long process to kind of get started with a counselor. So I encourage people not to worry too much about that, and research does support it, that really the effectiveness across different theoretical orientations is not significantly different, and that rather it's things like, is the counselor empathetic? Do they believe that in what they're doing and they believe it can be helpful? Does the client believe it can be helpful? Do we agree on what the common goal is? These are actually the factors that show more significant outcomes of therapy being effective than a particular degree or theoretical orientation. And so I let people know that to take some of that pressure off. And so a lot of what you're going to want to be asking when you're speaking to a potential counselor is more personality fit type things. How have you worked with people before? Do you feel comfortable with them? Does their presence or tone make you feel that you can, be yourself, be honest? Some of those more relational pieces, I think, are going to be more important when looking for a provider. But I still want you to be able to understand what some of the terms are and what's happening when you're reading profiles. We're going to talk about forms of payment, which is usually a big barrier to access. These are not all of the forms of payment. There are absolutely crisis options that are free or at very low cost, nonprofits that maybe are grant funded for a specific population and may cover the cost of a licensed therapist. College counseling centers often provide therapy, like embedded into tuition and things like that. But for kind of like the general non-population specific client, these are the main forms of payment. Private pay simply means cost for service. The session is $100 and you will pay them $100 on your credit card, cash, something like that, check. So it's pretty direct, simple. If you see a provider mention on their profile that they offer a sliding scale, all that means is that they're still private pay, so it's still cash for service, but that they're indicating to let you know that they're flexible in their rate. So maybe their rate is $100 per session, but they have a sliding scale. So they're letting you know that if your financial ability is not able to meet the $100, they're willing to have a discussion with you and talk about a reduced rate. And usually that rate will be for a certain amount of time. So I could see you for $75 a session instead for 3 months. And then at that point, I would either need to go back to my full rate or help you find somebody else also with a reduced rate or sliding scale. Pro bono means that the cost of services is free. Some therapists will offer a certain number of pro bono spots per year or in their caseload. And usually there's a time limit sometimes for how often people can offer pro bono, but that's what that term means. And then we will also go over health insurance, which is quite a topic. So I'll go right to it. If you are going to be using health insurance, which is always ideal, it's ideal for people to be able to use something that they already pay for to receive mental health services. So these are some terms that can get confusing. I've found that people at any age, any form of healthcare experience, sometimes are still confused about these different terms, and I think that they're important. So I'm going to kind of go over the really quick definition of these. In-network means that you, let's say, have Aetna health insurance and you're looking for a provider. Aetna will tell you, here are all the providers that we've already pre-approved. So you can see any of these counselors and we can guarantee you that they are pre-approved and this is exactly what your cost would be if you have a copay, if you don't have a copay, things like that. That's in-network. You may also have out-of-network coverage, which means that, okay, you would like to see a provider who is not pre-approved. We'll potentially go ahead and approve that, even though they're not pre-approved, but you won't get the same coverage. You may only get a smaller amount of coverage because they're not pre-approved. We can talk soon when we go over copay and coinsurance about what those different costs would be. But out of network means that, okay, we may provide coverage for this non-pre-approved person that you prefer to see, but it may not be the same amount of coverage as our pre-approved people. Some insurance companies do not offer out-of-network options. And so if you want to see somebody out of network, they may say, we don't cover that at all. Other plans will say, okay, we'll cover part of that. An annual deductible is the amount of money that you have to pay yourself before your insurance benefits start to kick in. So if you know that when you go to your primary care doctor, you have a $25 copay, you may not reap the benefits of that until you've paid your deductible. You may not have a deductible. So these are questions that you'll want to ask your insurance, and I'll go over a list of questions a little bit later that I have. So if you have a deductible of $1,000, you'll have to pay out of pocket $1,000 worth of your healthcare expenses. Once you've paid $1,000 yourself, now the next time you go to the doctor, you will only have to do that $25 copay. So a copay, I keep using that term, that's the fixed amount that when you receive healthcare services, you have to chip in that amount. They usually range from $0 to $30 when you're seeing an in-network provider. So yes, this person's pre-approved, you're good to see them, but you still have to chip in $25 for each session. Coinsurance is the amount that you'll pay if you are going to see somebody out of network. So let's say that a therapist's rate is $100 a session and they are out of network. And so your insurance says, well, we will cover only $50 of that. And so that would mean that you have to cover the additional $50 of that. And so that would include that you're paying basically kind of like that $25 copay, but on top of that, the remaining $25 to meet the full rate. And so there may be a time that a therapist's rate is really high. And so you may have to pay your $25 copay plus the difference of what the insurance won't cover. The therapist cannot waive that difference because it falls under like insurance fraud then. So you're still getting a smaller amount of reimbursement, but that's why you're paying more than just your typical copay. You're also having to pay the difference of what the therapist's full rate is. A super bill is just a term that's used for the receipt that you'll provide your insurance company. Okay. These are some of I listed out a couple of benefits and limitations of talk therapy. I mean, there's a lot of research that, supports more specifically like decrease in depression, anxiety, addiction, things like that. But kind of in a more broad sense, these are just kind of more layman's terms of how you might benefit from talk therapy. Sometimes there's some confusion around like, well, what am I going to talk about? How is this going to help me? But it's really looking to keep you, help kind of reduce stress. Therapist where your stress can be reduced. There may also be some increasing of stress just in the sense of talking about things that are difficult just so that you can move through and process experiences, thoughts, feelings, confusions. But it's always kept within a range that is manageable, and that's on the responsibility of the therapist to kind of keep things at a level that are productive. So maybe not your stress too low that you feel like you're just hanging out with your friend, not really kind of going inward or kind of challenging yourself at all, but not so much that you're going to have distress, high levels of distress during therapy. And so it's just encouraging an integration of feelings and thoughts, better communication. And there's, a lot of research to support the benefits, even after just one session. Of course, there are also limitations. Some of those we've already talked about. Time commitment, I think, is a big one. It takes time, and it's often not just the 50 to 60 minutes that a session usually lasts. That time commitment might be a little bit of time on the front end, some time on the back end, the energy that it takes from you, emotional energy that it may use. And so it is work and effort and time commitment to participate in talk therapy. There's also always the risk of sort of some interpersonal concerns. I mean, the relationship between yourself and a counselor is meant to be genuine, and it's meant to be intimate in ways. And so there's always a risk of hurt feelings. Maybe you don't feel understood at times. Maybe you feel judged at times. And that can be particularly painful when this is somebody that you're opening up to. The hope, of course, is that the therapist is going to work to mitigate that as much as possible. But it's important that people know that anytime you're entering like an intimate, close interpersonal relationship, there is risk involved as well. And then you can see some of the other ones listed as well. Should you decide that you are interested in pursuing therapy, this is not all of the ways to search for a therapist, but I just included a quick handful. I want to mention two in particular. Open Path Collective is a really nice organization that provides low cost, reduced cost therapy. It's everything there is sliding scale. It's based on your financial income and abilities. And so that's a much more accessible option for people who are interested, maybe don't have health insurance or can't pay like a more typical private pay rate. And then I'm going to talk about psychology today just because it's probably the most common. They have some nice filters, things like that. But as you can see, there's a variety of different sites that you could use to look for a therapist. This is what Psychology Today looks like if you haven't seen it before. I mostly wanted to show you this so you could see the filter options at the top. They make it really easy for you to filter by insurance, by price. Type of therapy might be like if you know that you're looking for a certain, you know that you want couples counseling, you know that you want EMDR. So you don't have to fill that part out, but if you have an idea of what you're looking for, you can, and it'll filter out your search options that way. Something else to note is that with the option of telehealth, which is pretty standardized now since COVID, our licenses are by state. And so if you're open or interested in telehealth, you can always expand your search outside of your geographic region. And so you actually can look at therapists across the whole state who provide telehealth and may be a good fit for you. Here are just some things that when you're talking to a provider and you're calling them to ask about their services, just some common questions you may want to ask about. You're also totally welcome to tell them like, hey, this is my first time doing this. I don't even know what I should be asking. And they'll be able to walk you through it as well. But just to give you a little bit of an idea about some things that you could ask them. And these are also some things that you'll want to ask your insurance company about. This can look really overwhelming. I mean, anybody who's called their insurance company, it's also a lot like calling your Wi-Fi company or, like the bank. Like it's just very overwhelming, a lot of hold times, things like that. And so sometimes we have to kind of work ourselves up to have the courage and tenacity to do so. But I definitely encourage it because once you do put that work in, you have that understanding moving forward. So the hope is that even though there can sometimes be quite a bit of effort on the front end, the hope is that it'll just pay off for quite some time afterwards. The first 3 questions are not as common anymore. I haven't seen that in quite some time, but it's possible. And then these other ones, we've already discussed what those terms mean. And so you'll just want to confirm what those numbers are or if they apply to you. This is just my disclaimer. As happy as I am that therapy is becoming more and more mainstream, I am a therapist, I go to therapy, all those things. I also want people to know that there are other forms of therapy outside of talk therapy that are incredibly beneficial, very much supported by research. I want people to know that you can decide for yourself based on what your needs are, what type of therapy would be best for you. I don't want people to feel that talk therapy is the end all be all. And so if for some reason it doesn't work for them or it's not meeting their needs at that time, that there's no other options of support for them. That's simply not the case. This is a very small list. There's so many other types of therapy outside of talk therapy. But this was just a quick little list that I came up with. And so again, depending on what your needs are, what your resources are, what you're wanting. There's a variety of other options to choose from as well. There are times that I've done talk therapy, and there are other times that wasn't what I was wanting, and I've benefited from some of these other types of therapy. And then now we'll go to questions and comments. I didn't change. I did this. It has the talk from today. And then there's also another talk I'll be doing in a couple of weeks. But yeah, it's open for questions and comments now that I think Becky is going to help me know what might be in the chat.
Yes, thank you, Melanie. And I typed this into the chat, but we seem to have an issue with the live stream at the very beginning. Okay. So my apologies to you too, Melanie, that folks may have missed the first few minutes of your presentation. We were live, but apparently YouTube did not think we were. So I believe it's working fine now. So folks who are joining us, you should be able to type directly into the chat box on the page on Survivor Space. Feel free to type any questions or comments. I know we're missing those first few minutes of content. My apologies for that.
Yeah, and even if they know where they picked up on, I can always just pull up those slides and just have them up too. So if there's somebody in the chat that knows where it picked up, you can let us know too.
I'll take your PowerPoint off here. Technology is great when it works correctly. Okay. Someone said they picked up about 7 minutes in.
Don't know that I was keeping track of minutes.
Yeah.
I could take a guess though. Oh, okay. So they probably didn't hear about types of clinicians, types of theories. Is that right? Person in the chat. Did you hear anything about different types of licenses or types of theories and styles?
And that might be because yes, they're confirming yes.
Okay, I can go if there's not any other questions coming in, I can just go through that super quick, and then see if there's questions on that part. Does that sound good?
Sure.
Okay. Are my slides up, or I should just do it verbally?
Yes, they're up.
Okay. Sometimes when people are looking for providers, looking at their profiles, there's so much jargon, it's like wild. So even clinicians, sometimes people don't know what that means. All that means is a therapist whose primary service that they offer is therapy. So there might be therapists who primarily offer administrative work, teaching, research, but clinicians means that their primary service that they're offering is actually therapy. These first four are the most common types of licenses and degrees who offer talk therapy predominantly. And so any one of the first four, you know that you're in the right place. The acronyms may change from state to state. For example, LMHC is a licensed mental health counselor. That's in the state of Florida. In Georgia, they call the exact same thing a licensed professional counselor. So it can get a little bit confusing. But when you see those acronyms, you'll know that any of those first four, you're in the right place. These bottom two are more likely to offer medication, prescription, and management, but I included them because they absolutely sometimes do and can offer talk therapy. You'll just want to clarify which one they're offering. So if you are looking for talk therapy versus medication, you may have different providers depending on the two. And then I just really quickly showed people that if you also see on their profiles that people are saying, oh, I'm a therapist and I practice from feminist theory. I'm a therapist and I practice cognitive behavioral therapy. They're identifying what theory they use. You could all be social workers, but across social workers, you may prescribe to different schools of thought about what you believe causes psychological distress and concerns and what contributes to psychological relief or healing. And so they're just different schools of thought. There's a nice little website that has a very long list. This is only a small portion of the list. Where you could click on one and see a nice little quick summary of what that might be. Don't feel that you need to know all the ins and outs of the theory, but I do encourage people to feel empowered to ask a potential counselor, like, hey, what is that all about? And see if that just sounds attractive to you, or do a little bit of research yourself, see if that sounds attractive to you. But it's not something that you need the pressure of knowing all the ins and outs of. Maybe I'll just leave it at that as a catch up, and then see if there's any other questions.
Okay, thank you, Melanie.
Sure.
As folks are having a chance to think and perhaps type, I'll kind of ask a question that someone asked yesterday, just what your opinion is about virtual online therapy. I know a lot of folks are kind of turning to that or turned to that during COVID, and maybe are still going in that direction.
Yeah, I found it to be a really nice option for people. It creates a lot of accessibility. People are able to, some of the benefit, you're trading out kind of maybe pros and cons sometimes. But there's a lot of pros of virtual therapy. You can do it from the comfort of your own home, which can feel a little bit more secure and comforting to people as well, as opposed to being in somebody else's space. Sometimes that could be a con. Sometimes when you're in your own home space, maybe you feel all the to-dos, or you have a crying baby, or something like that. And so again, it's a little bit person specific. But from what I've seen, whether you want to go in person or virtual, it's really down to preference. I've not seen anything that shows something to be like more effective than the other. I've offered both as a therapist, and I've also participated in both options as a client. At least for me, it's been a really smooth transition, a lot more realistic than I thought. It is important that you have, if you're going to consider virtual, that you have a very strong Wi-Fi connection. Delays and little freezes are super disruptive. And so for that can be a little bit harder, but sometimes people don't have the option to come in at all. And so that's the best that they're able to get. And so then it's a great option. But yeah, I think that either one, just again, depending on personal preference, your own personal circumstances, but they're both really great options.
Great, thank you. And someone actually asked about that shortly after I did, and kind of a follow-up question with that. Since therapists are licensed by state, how are they able to work across state lines?
They may be licensed in multiple states. So for example, I'm licensed in both Florida and Georgia. So I do have some clients who live in Atlanta, even though I'm located in Florida. So the way it is right now, for psychologists, I think it's a little bit different. I think they have a little bit better reciprocity across states. I think they have like a group of 10 states that have all agreed if you're licensed in one, we'll count you in for another. So it does differ a little bit across type, but for myself, who falls under counseling, we have to be licensed in the state that we are located in and the state that the client is located in. And so there are times where we're not able to practice across state lines. We can apply for temporary licenses. So for example, I had a client who did summers in another state. And at that time, there were still some emergency protocols because of COVID. And so I was able to apply for temporary licensure in that state so that I could continue to see that person. There's also some exceptions. For example, if a client is in crisis, or other type of exceptions where short-term somebody might be able to practice across state lines, but typically we can't with telehealth. But most professions are working hard to lobby to create more reciprocity across state lines.
Yeah, that's an interesting thought. Has there ever been like a movement or an effort kind of nationally to have the same license, the same credentials, recognized no matter what state you're from?
At least I think colleges again had a little bit better luck. I think that they may have a states that are to that. With states have gotten on board. I'm not sure if that's gone into effect yet. I don't believe that it has, but I do know that some have verbally stated that they will continue to join. I can't, maybe like it's agreed already for counselors. So we've been working toward that for a long time. It's getting states on board to agree. So it's still up to each individual state to say whether or not they're going to agree to that or not. But the providers, we've been working toward and wanting that for some time. I hope I answered.
I think so. I think your connection may be kind of going in and out a little bit.
Oh no.
But yeah, I think that we got the gist of what you were saying there.
Has it caught up at all, or is it still a little funky?
I'm hearing you fine. Yeah, your picture's a little funky, but We're just rolling with the flow today with, technology. Some days are better than others.
Yeah, I do see. Okay. Any other questions, Becky?
Not so far.
Okay.
I think there's also been a big movement towards offering more mental health counseling in schools. I mean, certainly predating COVID, but definitely a bigger push since COVID. Is that something that you're seeing as well?
Yes, school counselors have been struggling forever about the ratio of counselor to student. Sometimes one school counselor to 1,000 students. So yeah, definitely a push to have more. We sometimes can fall into a similar category as teachers, wanting us to fix a lot of different problems. Overworked, underpaid is maybe a short way to say it. And so there's a lot of burnout, there's a lot of turnover. And so there is a push to bring more in, but we so far haven't seen as much progress as we'd like in supporting our ability to actually be successful in the tasks that they're wanting us to do. But of course, we're happy that people are seeing the value of it. Definitely. There is an increase in that.
We did have a question come in regarding like social issues with kind of your relationship with your therapist. So what are your thoughts on, say, things like inviting your therapist to your wedding or other types of situations that might come up like that?
It really does depend on sort of your relationship with each other. Some therapists sort of range in their comfort level with that, not even just social interactions, but even within your session. Some counselors are more comfortable to show their personality, cuss, make jokes, like be like kind of show themselves more, even just within the session. Other counselors maybe are a little bit more reserved, sharing personal things, don't mention if they have a partner or anything about themselves. So even within sessions, there is a difference in kind of how therapists relate, like what intimacy looks like for them, what their style is. And so it would be similar moving outside of the therapy office as well. It's totally not unheard of. Yeah, people have gone to weddings. Maybe they're closing up and it's your final session and, you grab a coffee after. There's always risks involved when you're, there's risks and benefits like anything. So some of the benefits of maybe being a part of certain events that are important and maybe especially have to do with therapy, maybe have to do with the time you've been spending together. Some of the benefits are continuing to grow in relationship, intimacy, trust, things like that. There's always risks involved as well. You may see a different side to your therapist that could feel disruptive or confusing. They may see a different side of you, so there's, it's not uncommon by any means. So some of it is personal comfort level of the therapist, what the relationship is like, if it feels appropriate, things like that. But it should be a collaborative conversation. Typically, it wouldn't just be like a yes, I'll do that, no, I won't. Typically, the therapist would be responsible for managing the pros and cons with you, so that you could be informed of, okay, if I came, these are some things to consider. How do you feel about that? And so they would kind of go through some of that with you.
Yeah, that's a great question, because when you think about like the therapeutic environment, you're kind of, sharing really intimate things with this person and building rapport over time. And then, if you're therapy sessions kind of end, it's sort of like, well, what now? Like this person that I've shared my life with forever, I'm just not going to like talk to you ever again or see you ever again.
Sure. Yeah, I have clients that still send me messages many, many years later, just, hey, moved to here, having a good time. It's always nice to hear from people. I still message old therapists. My dog's 5 now, not all the time, but there's still, it is a professional relationship, but I think therapists also show professionality in their own way. So professional doesn't have to equate to like rigid or closed off or like a blank slate. That professional can very much be full of love and respect and laughter and joking and humor, and that can still be very professional. So it is a professional relationship, but how that can look can differ.
Great. Thank you. And a comment of very helpful.
Okay,
So
good.
Thank you.
Sure.
Any other thoughts or questions? It's a lot of good things to think about with this issue. Melanie, I know we kind of touched briefly on this yesterday, but what are your thoughts about like a survivor seeking a therapist that is of the same gender or the same identity as them? Is that, something that, obviously it's important to think about, but, what are your thoughts about that, in terms of like the identity of the therapist matching the survivor?
Sure. The most common example that I see is, of course, survivors looking for a therapist and not wanting somebody in that demographic, whether that be gender, size, facial feature, anything, any sort of demographic trait where the therapist might remind them of their perpetrator, their abuser, and then that's totally common and appropriate. And so again, you're trading out pros and cons. And so to be with a therapist whose demographics feel safer, don't mimic or remind you of your perpetrator or abuser is totally appropriate. That can create an initial sense of ease or safety, and that's absolutely fine. By chance, most therapists right now are still women. I think that's changing, of course. So it can be a little bit more difficult if you're specifically looking for a male therapist, but they are absolutely more and more out there now. And so there's benefits to being with somebody in a demographic or gender that you're more comfortable with. And of course, for other people, maybe they're looking for a reparative experience. And so maybe they're looking to meet with a male therapist. And maybe their perpetrator or abuser was also a man, and looking to see if they can establish that, oh, wow, there can be a reparative experience here, one of respect and safety and security. And so I encourage that people don't try to let go of any expectations or pressures on yourself, like, oh, I should see this type or I should see that one. I recommend the path of most ease and exhale, and that both it's perfectly appropriate to have a preference and to go with that.
Great. Thank you. I know we have just about another minute or so if anyone else has a follow-up thought or question. And just like before, we'll leave the chat up for a while after the session's over today. So please feel free to continue the conversation. If you have questions, you're welcome to type them in the chat. And if you would like Melanie to provide a response, I will certainly help facilitate that. So. That's great information. And as Melanie mentioned, our next session will be on June 15th at 4 p.m. Eastern Time. on the topic of de-escalating emotional crises. So that will be a very helpful, very interesting topic. I'm looking forward to that. And please visit our website for updates on new sessions that will be scheduled for the summer. And we're very, very glad that you joined us today. And again, please continue the conversation if you like on the chat, and we will see you next time. Thank you all so much.